Acute otitis media. Acute otitis media is an infection of the air-filled space behind the eardrum or the middle ear. So, acute otitis media is an infection of the middle ear. Normally, children are more likely to develop acute otitis media than adults. This is because they have more viral infections than adults and they have shorter, more horizontal Eustachian tubes. And the peak age of incidence of acute otitis media is from 6 to 18 months. When we see risk factors for acute otitis media, smoking, which can be direct or a passive smoking, craniofacial abnormalities such as cleft palate, and the family history of otitis media is thought to predispose a child for recurrent attack of otitis media, lack of vaccination, especially pneumococcal vaccination, having gastroesophageal reflux, prematurity, and recurrent upper respiratory tract infection predispose a person for having acute otitis media. When we see common pathogens from bacterial, Haemophilus influenza, strep pneumonia, and Moraxella catarrhalis are thought to be the most common etiologies for acute otitis media. Still, Streptococcus pyogenes can also cause acute otitis media, but the three most well-known for causing acute otitis media is Haemophilus influenza, strep pneumonia, and Moraxella catarrhalis. From viral, RSV, rhinovirus, adenovirus, influenza virus, and the parainfluenza virus can cause acute otitis media. We say recurrent acute otitis media if there are more than 3 separate acute otitis media episodes in 6 months or more than 4 episodes in a 12 months with at least 1 episode in the past 6 months. Symptoms of acute otitis media include earache, holding or tagging ear, pulling ear, and non-specific symptoms such as fever, crying, poor feeding, cough, and rhinorrhea. On otoscope, we might see red, yellow, or cloudy tympanic membrane and bulging of tympanic membrane with loss of normal landmarks and air fluid level behind the tympanic membrane. Perforation of tympanic membrane with or without discharge in external auditory canal can also be seen. Differential diagnosis for acute otitis media include for ear pain only, common cause for ear pain in addition to acute otitis media include Eustachian tube dysfunction, otitis externa, mastoiditis, and referred pain from dental problems. Other cause of middle ear inflammation or effusion include otitis media with effusion. Acute otitis media is not the same as otitis media with effusion. Otitis media with effusion is fluid in the middle ear without signs and the symptoms of infection. In acute otitis media, there is sign and the symptoms of infection, whereas in otitis media with effusion, there is no sign and the symptoms of infection, but there is middle ear fluid in the middle ear, and it's often asymptomatic and other than transient or conductive hearing loss. So the most common symptoms of otitis media with effusion is either asymptomatic or having hearing loss. Antibiotics are not routinely required in this case, as most occur after an episode of acute otitis media and resolve spontaneously with long-term effect. The other differential for middle ear infection is chronic suppurative otitis media with or without cholesteatoma. We say chronic suppurative otitis media if there is persistent inflammation and the perforation of tympanic membrane with draining discharge for more than 2 weeks. Cholesteatoma occurs when keratinizing squamous epithelium is present in the middle ear as a result of tympanic membrane retraction. They might have hearing loss or tinnitus and they may not have ear pain or fever. When we see the management of acute otitis media, 60% will improve within 24 hours without antibiotics, and the usual duration of the illness is around 3 days for most cases, but can be up to 1 week. Serious complications are rare after acute otitis media. Choice of antibiotics for acute otitis media includes the first line is amoxicillin for 5 days, and if the patient is having penicillin allergy, clarithromycin or erythromycin can be given for 5 days. Second line, only if amoxicillin has failed, is coamoxicillin, such as augmentin, Clamox, and other Coamox Clav for 5 days. Thank you for watching.